Chelsea Clinton launched a bizarre and wildly misleading attack on Bernie Sanders for her mom and her campaign. She's going to go after his health care plan here.
Senator Sanders wants to dismantle Obamacare, dismantle the CHIP program, dismantle Medicare, dismantle private insurance. Now, the Republicans in Congress have voted against the Affordable Care Act 55 times. Right? Not because they want to replace it with something, because they want to get rid of it. So I worry that if we give Republicans democratic permission to do that, we'll go back to an era before we had the Affordable Care Act that will strip millions and millions and millions of people of their health insurance. And Senator Sanders wants to devolve the authority to set up state health insurance programs to individual state governors. Now, maybe if I lived in a place like New Hampshire with your governor, I would feel okay about that. But if I lived in a state that had a Republican governor, particularly a Republican governor who already turned down Medicaid expansion matching funds, I don't think I would be comfortable, right? Because I don't want to live in a country that has an unequal healthcare system again. So I don't want to empower Republican governors to take away Medicaid, to take away health insurance for low-income and middle-income working Americans. And I think very much that's what Senator Sanders' plan would do. So I think we need to protect the Affordable Care Act while we look to actually expand the Affordable Care Act and make health insurance even more affordable and available, not go back to where we were before President Obama's administration. Currently, there's a $19 trillion gap, give or take, between what Senator Sanders has proposed and how he's articulated paying for his proposals. So that, to me, is troubling. I really believe, not only from an equity perspective, that what my mom has articulated in terms of expanding access to affordable college is the right answer. It also gives me greater comfort that she's more able to probably get it done because she's already articulated how she's going to pay for it.
Okay, that was a laughable attack. That was embarrassing. That's probably the best word to use. Now, Huffington Post breaks down some of this here. They say, because a single-payer plan would require the government to raise literally trillions of dollars in revenue, Clinton has assailed Sanders for calling for a massive tax hike. They continue, that's true. What Clinton never mentions is that those taxes would displace existing private insurance premiums. So understand what they're saying there. The way that they're calculating it, they're pretending like we're going to take a single-payer system and implement that while making everybody continue to pay their private insurance premiums and continuing to also have private insurance, and it would cost just as much as it does today. But wait, that doesn't make any sense. If you do a single-payer system, you are replacing the shittier private insurance system, and the whole purpose of that is so that you decrease the cost and get everybody care. That's the whole fucking point. In fact, they go on to explain that. Quote, it's true that under a scheme like the one Sanders envisions, most people would lose the insurance they have today. But that's because everybody would have the new government-provided insurance instead. The whole point of a single-payer plan is to make sure that coverage is simpler, more comprehensive, and more reliable than it is today. She also does another sleazy trick there, where she talks about how, well, what am I going to do? The states, I mean, they're rejecting the Medicaid expansion under Obamacare, so what am I going to trust them to try to implement Bernie Sanders' plan? She conveniently leaves out that it was the Supreme Court who allowed red states, or just allowed states in general, to opt out of the Medicaid expansion if they so chose to. If Bernie Sanders implements his plan, they don't have a choice to opt out of it. The ruling for Obamacare does not apply to future legislation that's different legislation. That's Bernie Sanders' plan, which is Medicare-For-All, which is a single-payer plan. They wouldn't be able to use what they're allowed to do under Obamacare to wiggle out of doing new legislation that's a totally different healthcare plan. So when she starts saying, you know, I'm afraid the Republicans are not going to blah, 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 that's just a dodge of what Bernie's actual plan is. That's why I say it was confused ramblings from the beginning. And, you know, perhaps she actually believes, I don't know how anybody can believe this if they know anything about politics or substance, perhaps she really believes that Obamacare is somehow more liberal than single-payer health care. Which is, again, why I say this is perhaps very embarrassing. So here's what you need to know. About 10% of people are still uninsured under Obamacare. And she's like, come on, no, let's not do Medicare for all. Let's not do a single-payer system like every other modern nation has to one extent or another. Let's not make a better system where we have 0% of people uninsured. We need to keep the progress we made, so let's keep Obamacare and just have the 10% of people uninsured. Keep it bad because that's more progressive than 0%? But that's not. So when she throws in there at certain parts, you know, what I think we should do is build on what we've done with Obamacare. That's the right plan. When she throws that in there, she's fucking clueless that also applies to Bernie Sanders' plan. We should expand on Obamacare and, like, you know, make it better, improve it. What the fuck do you think a Medicare-For-All system is? It would be an improvement upon Obamacare. Obamacare made it so that we had a wild, wild west, capitalist, free-for-all, for-profit insurance system and healthcare system, and it made it so that, okay, now we have an individual mandate. We expand Medicaid a little bit, and now we have an individual mandate where you have to buy on the private market. Well, the next logical step is, let's do Medicare for all. Let's expand universal coverage here by paying for it via taxes and by, you know, coming up with a system like every other modern nation where if you get sick, you get help, and that's the end of the conversation. So that was terrible to watch. I don't know why she made that attack. And of course, Hillary Clinton is also now going after his healthcare plan. And Hillary wonders, like in 2008, she wondered, I can't believe a black guy named Barack Hussein Obama beat me. Why did he beat me? Hill, you're doing it right now. Why doesn't she love me anymore? Bro, you're doing it right now. Why won't they vote for me? Why don't progressives and liberals like me? Why is Bernie surging in the polls? Why am I feeling a random burn on me right now? For what you're doing right now. You're a leading Democratic, presidential candidate, and you're out there making arguments and having your daughter make arguments against universal health care. Liberal my ass cheeks. Step aside, son.